Dr. Shakib here from CoreCore Pelvic Floor Therapy and Irvine Spine and Wellness Center in Irvine, California. I am here with Christy, who has agreed to share her experience with you guys so you better understand what it is we do and how there is so much more you can do about your condition. So Christy, can you tell us, for one, how far do you drive to get here?
It's about an hour and a half with no traffic.
With no traffic, an hour and a half. So this is a 3-hour trip, coming and going. And why was that? Why do you drive all the way here?
Well, your pretty expertise at knowing what is wrong with me. Because when I came in, you were able to go, oh, and this, and we can work on this, and we can work on this. Whereas some of my other, my primary physician and another doctor were like, oh, maybe you're just a little depressed. But you knew right away you could analyze my body and say, oh, wow, look at this and this and this. So for me, it was absolutely worth the drive because I on medications I don't need.
I appreciate that. So the examination that we did is what's referred to as postural neurology, the neurology behind posture, and the treatment included what is referred to as functional movement, dynamic neuromuscular stabilization, or DNS. Those are very specific baby exercises that we do, and then we started incorporating emsella chair to specifically address the weak pelvic floor muscles, which is a part of the dysfunction. Now, what brought you here? What exactly was going on?
I wanted to feel better.
So what was the problem?
I was exhausted. I had my right-sided weakness, which I knew needed strengthening because I didn't used to have that problem, but then I got sick.
So the sickness she's referring to is
COVID.
So she ended up with COVID, and then all of this kind of got highlighted.
Yeah, and so I would like to get back to work, so I need the strength to do that.
And what is it that you do?
I'm a respiratory therapist.
So she is the one that rescued every single one of those COVID patients in the hospital, and then you got the COVID and the weakness. Yeah. So in the process of, after the examination, and we started doing the treatments, one of the things that we focused on was breath work.
Yeah.
Which is huge for both postural and pelvic floor dysfunction, which you actually did well laying down, not so much.
Yeah, it's a lot.
And all the other movements that you're awake can do, which is like moving around.
Yeah.
So the exercises, how different are these exercises from what you know of exercises?
Well, just the breath work alone, just practicing that makes a huge difference. And even just my pain and the way I hold my body and the way, like you were saying, I keep leaning forward. So I'm constantly now more aware when I'm talking and go, oh, well, my back hurts a little bit. Oh, well, that's because you're leaning forward. And now take some breaths. So just reprogramming my mindset and my thinking and reminding me where I need to be.
Right. That's part of postural neurology that we do now. As far as exercises are concerned that we do, those are baby exercises. Yeah. Literally what we all did as babies. So, are they easy to do?
No. Now I know why 3-month babies, they fall all the time when they're trying to walk.
Now we know why babies don't like tummy time.
Yes, it's hard work.
So that was, I just wanted to, for everyone here to really hear your perspective as to what happens here. And for you guys who are watching this either for postural dysfunction or pelvic floor dysfunction, you have to understand that there's so much that can be done, and your situation may have the same name as Christy's or someone else, but your story is very unique to you. So there is always hope, and what generically is being done provides just that, generic results. Thank you for watching. Thank you so much for shared your experience here.
Yes.
And if you have any questions or any comments, contact the office. The website information is in the description box. Take care.